Hey, welcome back, everybody. Who would think that a lack of sleep could affect your work ethic? It could affect, it affects your sleeping patterns, obviously, but also, what about the heart?
It does a lot of damage to the heart, something that we haven't always talked about in the past. Dr. Lindley, an interventional cardiologist from McKay Hospital, joins us now. And, people know it affects their mood, their appetite. What about the heart? How does it affect the heart?
Yeah, and thanks for having me. So it can affect the heart in a lot of different ways. Just like the rest of our body, when we sleep and everything relaxes and rests, our heart does actually the exact same thing. It slows down by about 10 or 15 beats a minute and actually allows it to recover.
How do we know if we have sleep apnea? Because we're sleeping. And so it's hard to tell. You're not getting the sleep, but you don't know why, and you feel tired. But this is a big problem across America, sleep apnea.
It is, and that's a great question, because a lot of the signs and symptoms of it are really nondescript, meaning it can mimic a whole lot of other things.
Right.
So a lot of daytime sleepiness is the first thing that we ask patients about. If they're having a whole lot of daytime sleepiness or just coming in from outside after not doing much and falling asleep immediately. Also, the number one risk factor is actually being overweight or obese, which unfortunately is more than 50% of America, and even here in Utah it affects that many people. And then the last thing is really to ask your bed partner, and they're the ones that actually know best.
Because you're keeping them up at night.
They are, yep. And if they tell you that you're snoring a whole bunch, or that they're starting to sleep in the other room, or they've always slept in the other room, then that can be a sign that maybe there's a problem and you need to come in and see us and get checked out.
Sleep apnea is a kind of a complicated problem. What can people do if they have questions? I know we got some experts here behind us today.
Yeah, absolutely. So they can call in and call the number. They can talk to their primary care physician, which is actually a great screening tool. Actually come in and see us in cardiology. Actually, as a cardiologist, I've found out that I treat sleep disorders actually quite frequently because they have such bad side effects on the heart, especially when it goes untreated. And I unfortunately see the end product: high blood pressure, uncontrolled diabetes, heart attacks, strokes, and even sudden cardiac death in sleep.
All from sleep deprivation.
All from sleep deprivation and all from sleep disorder breathing. But it's something that we can treat.
What about just when people have insomnia and it's just, it's rare, but you do go a whole night without sleeping?
It is.
Can that affect the heart as well?
Usually not. It's really the sleep disordered breathing that we worry about. Okay. Usually people have insomnia because of some short-term side effect of something else going on in their life, and we can control that.
Which can also affect the heart, right?
It can, but really if you're having a whole lot of daytime sleepiness or snoring a whole bunch, come in and check it out and come in and see us with your doctor.
Okay, some great tips for us today. Thank you so much for being with us.
Thanks for
All right, don't forget, call the phone lines right now. These guys have some great advice for you if you're having sleep apnea problems or you have a spouse that has sleep apnea problems.
We have another story to go to now.